Hi, I'm Robert Seek, Chief Science Officer of Hytiva. Today I'm with UFC Hall of Famer Stephan Bonnar, who's had a 15-year career in professional fighting sports, marquee fights. Stephan, give us a little summary of your fighting career.
All right, fought pro from 2001 to 2015. Also had an amateur boxing career, won 2 Chicago Golden Glove titles at super heavyweight, 02 and 04. Fought in the UFC close to 10 years, fought 7 world champions total, the who's who of the sport, and trained with the who's who of the sport. So a lot of shots to the head from the best.
Well, yeah, and that's right. Brutal training, brutal fights that you've had, and today we're here to talk a little bit about CBD, or cannabidiol, for the potential to treat TBI, or the symptoms of concussive syndrome, which you and I have talked before. You definitely had some of that after your long and brutal career. So give us and our viewers a little quick summary of what you felt.
Honestly, it was subtle, and it kind of crept along. In 2013, when I first retired, maybe once or 2 nights a week, I would have trouble falling asleep, and then when I woke up, I couldn't go back to bed. When I retired for good in 2015, it was just about every night. And on top of that, my memory was really bad. It was more from hearing stories from other people, like, oh, you don't remember? We had this conversation. And then getting lost too, where I'd forget where I was going in my car. And those 3 things, the sleep, the memory, the confusion, getting lost, are probably the 3 most notable side effects.
And these are all common symptoms of TBI and concussive syndrome. And what we wanted to talk about today, CBD, cannabidiol, just want to inform everyone what that is. CBD is cannabidiol, and it's actually one of many phytocannabinoids found in the cannabis plant, although it is the predominant one. But what's interesting to note is that the human body has its own endogenous cannabinoid system, or endocannabinoid system. And research, one of the first studies has actually shown that there is an endocannabinoid system and that these cannabinoids could have potential benefit in brain injury, was published in 1998 in the publication of the National Academy of Sciences. And it showed that people who suffered from stroke or loss of circulation to parts of the brain, CBD actually provided some benefit, the endocannabinoids provided some benefit in actually reducing the symptoms of injury. So let's get right to it. You had symptoms for years. Someone talked to you about trying a CBD product, and what we want to know is, what did you try, how did you use it, and what changes did you notice?
Well, I used the CBD oil, and I was for insomnia, to be honest with you. I just wanted something to help me go to bed. I wasn't so worried about the concussions because I had retired at this point. I didn't really put everything together about the trauma that I had taken and that CBD might be. I was just trying to get to bed, to be honest with you. And I didn't take it. I kind of took it sporadically, but then I probably, after about 6 months of taking it on a regular basis, it was like, wow, I think this stuff's working.
So 15-year brutal career, 6 months of using a product, and you notice some benefits. Well, what you said echoes some of the emerging research. So emerging or preliminary research is not enough to say that CBD is going to be approved as a drug for treating TBI or concussive syndrome. But what we do know is that not only athletes like Stephan, other professional athletes in the NFL and the NBA have also said they want access to CBD and also medical marijuana products specifically for brain injury. And why? Because other research that is emerging shows that what does CBD do? So we have our endogenous cannabinoid system, and if we introduce CBD that you took like a product, we could potentially provide more protective benefits. So what is it doing? Some of the emerging research shows that CBD products actually remove harmful mediators that happen in response to injury. The cells get damaged, and there are harmful mediators that cause damage to other cells. There's also inflammation in the areas, which CBD can help reduce. And brain injuries often help when you can improve circulation. And in response to brain injury, the body releases its own endogenous cannabinoids. And other studies have shown that people who've sustained traumatic brain injury that may have already had CBD or combination CBD-THC products on board are actually less prone to having more severe symptoms from that injury. So there's definitely enough interest from other professional sports organizations, and there's a lot of public interest too, which is why we're making this video on CBD. So if you would like to learn more about CBD and its potential usefulness for TBI, concussive syndrome, and other issues, please go to the Hytiva Learning Center at hytiva.com. We have a whole CBD video series. So thanks for tuning into this one today.